So thanks everybody for joining. My name's Jo. I'm the Charity Secretary for PoTS UK. You have all signed up to the PoTS and long COVID session and the title being Effects on Life and Work. I'm really thrilled to introduce Dr. Claire Rayner and Dr. Amy Small, who have very kindly given up their time today to discuss with you. They're going to have a bit of a conversation with one another about how long COVID has affected them and different things like that, which will be for about 25 minutes, and share some slides. And then we're going to have about 20 minutes for questions at the end. If you pop those into the Q&A box, which I can see we've already got a couple, so that's great. So if you can pop those into the Q&A box as we go through, I will ask them at the end. We tend to kind of pick them out rather than asking them in the order that's been received, just to give everybody a chance. As always, the session will be recorded and added to our YouTube channel. I'll try and get this added on as quickly as possible. So if you can't stay for the whole session or you want to go back and watch anything, then that's great. And obviously you'll be able to share that with people if you would find that useful. At the end of the session, there will be a survey that pops up on your screen. I always say this, I'm sure lots of you will have attended webinars before with PoTS UK, but it really does help us if you fill this in, as it just helps, it asks for ideas for future topics, and just helps us get feedback on what you're really looking to get from future sessions and how useful you found the session today. So if you are able to spend, quite literally, it's just 2 minutes completing that, it would be really helpful. I think that's everything for me. So I will hand over now to Dr. Rayner and Dr. Small. I will just give the result of the poll because I don't know if can everyone see that, or is it just me? No, okay. So do you have long COVID or look after someone who does? 51% have said yes and 49% have said no. So quite an even split. So I will hand over, I'll mute myself. If you need anything from me throughout the session, just say, but I'll be scribbling and making notes about questions as they come through. But thank you both very, very much in advance. Thank you.
Thank you.
Hi, I'll just start off with we've got a few slides to show and then we can introduce ourselves as we go along. This is where technology is going to let me down, I'll see. So can you see that? Yeah, great. So I thought this was quite a good picture actually, depicting probably any chronic illness, whether it's long COVID, PoTS or anything else. You know, it's very much a long road ahead with lots of ups and downs, and kind of that to me spoke quite loudly. So I'm Amy Small, I'm a GP in Scotland, and prior to getting sick, this was me. On the left, see a picture of me with my family. My boys were 3 and 5 at the time of us getting ill, and this was taken probably about a week before we got ill last year. Me on the right, doing many 5 and 10Ks. I wasn't a marathon runner, that's probably a bit of a cheat, that medal, but I did do quite a lot of running, and that's me in the middle. I do quite a lot of work with the British Medical Association and other things, and I was basically working full-time as a GP partner alongside all the other medico-political stuff that I did. And COVID kind of hit our family like a ton of bricks. I think, like many people, didn't necessarily have needed to be admitted. We stayed at home. Perhaps we would have been admitted if we got ill later on in the year when criteria changed and things like that. But both my husband and I, and the kids, we all got it, but both my husband and I, as a consequence, have developed long COVID. Both our journeys have been quite different in that I've had the sort of more PoTS dysautonomia type symptoms, and he's had a lot of issues with cognitive fatigue and relapses from that, but not had issues with PoTS. So for us, it's been quite a mixed bag, whilst also looking after our kids. So I actually lost my job as a consequence of having this. So this has made me really passionate about trying to make sure that people get early diagnoses of illnesses, that they're treated with the right medication, that they have the right support around them, because it has such a huge and significant impact on us in so many ways, I think, many more than I think perhaps those in power realise or realised initially. So I met Claire through Doctors with Long COVID Facebook group. So we met probably guess maybe 10 months ago, Claire, do you think it is?
Yeah, I reckon so.
Yeah, so so I'll hand over to Claire so she can introduce herself.
And then with the doctors group, we were probably some of the first members, weren't we, when there was really maybe 20 or 30 of us, and then it just grew to be a huge amount. And it feels like we've been in this little well, it's quite a big now hothouse of discussing what has been happening to us, because it was absolutely bizarre, as I'm sure any of you who experienced these symptoms know what it's like. So we've done so much talking and research and sort of campaigning together, I suppose. So my background is a little different. I did do GP training, but I then specialised as an occupational physician. And I was put in the clinically extremely vulnerable group because I've got a whole mixed bag of previous medical conditions. So I kind of knew that I would get COVID at some point. I can't, look at a virus without getting it. So I was not surprised when mid-March I came down with symptoms. And one thing led to another. And as Amy says, a few of us met up and we've sort of been campaigning really to raise awareness of what people are experiencing, both with the symptoms and with trying to get help. So that's me and my background really. So I'm very passionate about health and work particularly, and I think that's why I went into occupational medicine, because I'm just really passionate about people being able to work and then not being made ill by it either. So one of the big this is a wonderful picture coming up. A lady called Paulina Sparks did them. I mean, what is long COVID is the question that people are often asking, and it causes symptoms everywhere. This lady, Paulina, is from one of the big patient support groups. And she did these cartoons for me for a previous talk. So as you can see, pages of a calendar, we just keep tearing the pages off and it keeps coming. But her pictures reminded me of some of the symptoms that we describe. And we kind of all describe the same thing. So an elephant, like an elephant sitting on your chest, is something patients have often said to each other about the chest pain that they get. And it's uncanny how many people will say it feels like an elephant sitting on my chest. So there's something really heavy, really significant about that pain. And I will briefly mention some of the sort of medical problems that may be caused by. Another one I'd forgotten is illustrated by this snake constricting somebody's chest, because a lot of people feel a real constriction in their ability to breathe. And it can be almost a pain. And there is a thing in another condition, multiple sclerosis, where people describe the MS hug. And when you listen to people, this sort of constricting pain is something that can occur, that people with MS experience. So it reminded me of that when I heard about it, because we know now this virus causes a lot of neurological symptoms. So to me, that would fit. But a picture just says 1,000 words. And the one that you can see just at the back is somebody who's running after their brain. Oh, my brains! Because that's what it feels like. The cognitive problems are very, very common. And I say cognitive, I'm not talking necessarily about anxiety or depression. I'm talking about how the brain works. People can't remember things.
How did you find it affects you, Claire, day to day, that sort of issue?
Well, with the brain thing, for the first 3 months, I think I was quite out of it. I think I had episodes where I was a little bit strange even. And I mean, I had such a headache at one point that I put a TENS machine, that you'd use for pain on your back, on the bottom of my head. And that seemed perfectly normal to me at the time. But it's not. Yeah. However, the pain was that bad. It perhaps illustrates that. But so I had episodes where I was actually confused. And then after about the 3rd month, I seemed to start then with these brain problems. So 2 issues. One was I couldn't find words, and sometimes words would come out swapped around, or the syllables would swap around. It was really specific. The other thing is memory, is the short-term memory. Just, when you go to make a cup of tea and you've forgotten that's what you're going to do.
Yeah.
In fact, making a cup of tea is quite a problem, isn't it? Because you, with your sort of PoTS-like problems, even getting up to make a cup of tea, people describe, don't they, as being difficult.
I think that's what I realised last summer before I even had a PoTS diagnosis. You know, I was relaxing a lot of the time, trying to rest and sitting actually outside in the sun, and couldn't work out why I always felt so much worse after I'd done that. And of course, now knowing what I know now about PoTS,
Yeah.
I understand why. But I found that my language was really disturbed actually when I came in from having been outside for a while.
Oh, yeah.
I found if I had been out for a walk and had pushed my heart rate up too high, things like that, I would then find that, you know, all this brain fog would kick in and I'd slur my speech. And so for me, it wasn't until my PoTS was corrected that actually a lot of those symptoms went away. And that's, you know, I'm ashamed as a GP to sort of say, gosh, I hadn't had a clue, you know, and I've had patients in the past come to me with PoTS and I've not really understood much about it. Always found the PoTS UK website really helpful every time I did come across someone with it, but it wasn't something I knew much about, and I certainly couldn't have advised things in the way that I can now in order to help patients, having had first-hand experience.
But we're not taught about it at all. It literally doesn't. I mean, I'm more than 30 years qualified, and I've only heard of it because I have autonomic problems from other reasons. We're just not taught, are we? It's almost like this big black hole, and hopefully the awareness is getting better. But it was only when we were talking in the doctors group, various of us, that some people started to say, when I stand up, my heart rate goes haywire.
Yeah.
And although I have never had PoTS myself, I have other chronic conditions, which mean that I live with autonomic dysfunction. So I have very low blood pressure and I have to manage it in a similar way. So I said, oh, but this sounds a bit autonomic, I was saying to some of the other doctors. And this is how we just started conversations. And I have always found the PoTS UK website invaluable for that very straightforward advice that it gives. So I think we were kind of working it out bit by bit, and we've come to realise that the autonomic problems are huge, aren't they?
And I think also that's something important for patients to realise is that, and that's something that Prof. Cavi taught me when I spoke to her about PoTS, is that we're seeing a lot of people with long COVID who have developed PoTS-like symptoms, but may not fulfil the criteria exactly for PoTS. So more what we would call dysautonomia. And we think that's what we're seeing a lot in long COVID of patients who've got prolonged high temperature, so prolonged pyrexia for many months. And I think some of the hypothesis is that COVID's affecting the hypothalamus, the part of the brain that controls our heart rate, our respiration rate, and our temperature control. So I think that's a bit that's going to be tricky, I think, maybe for some doctors and for some patients to understand that we might not fulfill strict criteria, but actually we may benefit from a lot of the lifestyle changes and a lot of the medications that people with true diagnosed PoTS, you know, on the tilt table or whatever, however else you want to do it. So I think that's something that patients may need to help advocate for themselves when speaking to their GPs and say, actually, you know, I think, you know, some of these things may help me. And I think GPs and other doctors need to keep an open mind when coming across patients like us, because I don't think that I probably even fulfill the criteria strictly, but had a GP with an open mind, and the medication, the lifestyle stuff has really helped me.
And what was that medication that, because I remember it making a massive difference after a couple of weeks, even you were dramatically better.
Yeah, well, I went from not being able to walk to keep up with my 4-year-old to being able to work. I mean, for me, that took a couple of weeks. So I initially started on bisoprolol, which is a beta blocker. I'm not asthmatic, so I was able to try that. And that helped me really, really well. But after a few months, I found that my mood was low, and a side effect of a beta blocker can be depression. And also it made my psoriasis go a bit bonkers, and that's a known side effect of beta blockers. So I chatted it through with my GP, who I said, you know, I understand other people are taking a drug called ivabradine, which is safe for people with asthma and other conditions. And I said, I'd really like to try it because I'd like to try and get rid of these side effects I've had with bisoprolol. So she contacted cardiology just by email, and they said, yeah, go ahead and try it. And I've been really lucky that has now worked for me. So I'm now able, you know, having not been able to walk more than 100 yards, I'm now able to do 15,000 steps if I need to, you know, out on a walk with my kids. So, and I can work full time. So for me, it was absolutely life-changing at that point.
Wow.
I'm lucky that it was that helpful, because I suspect maybe not everyone gets as much benefit from it as I did.
No, but quite a lot of people that we know seem to get quite a lot of improvement with something that helped with their heart rate. And I think what we've discovered, and what one of our messages to you is probably, you know, there's no one thing that gets on top of things like PoTS and other autonomic function. It's the nibbling away at all the different bits and trying to work out which factors that you need to adjust for. Shall I go on to my next slide to give people? So these are just to give an idea of what this is about work, because I think what's important is how long COVID and autonomic problems affect our function, as Amy's described. And from seeing a lot of people with long COVID, and also just knowing about how anything affects our ability to work or function, I would say these are the things that are most difficult, and they may resonate with some of you. So there's the neurocognitive, the brain effects that seem to come after this virus. I think that hopefully these will improve. They could be caused by several things, but what we're finding is over the course of several months, quite often these improve gradually. There's the postural tachycardia syndromes. It may not just fulfill the criteria for PoTS, as Amy says, but there can be other causes of a fast heart rate. And that just seems to be a real killer for the, you know, how we function day to day. A lot of people with long COVID have fatigue, but in a way, I don't think that's surprising given the amount of physical problems and the brain problems itself, which can cause fatigue. But not everyone is fatigued. So I have had all sorts of different problems, but bizarrely never felt tired. I felt sleepy in the first 3 months, but I would never felt I was fatigued. I had chest pain and breathlessness, and these cognitive things are from month 4 to about month 10. And this pain was like an elephant sitting on my chest, and it was probably angina. So I don't forget to mention it. I did go and see on video a doctor who used to work at the neurological hospital, but she's a cardiologist. So she used to work alongside the autonomic people at the Queen's Square Neuro Hospital. And she said she was seeing a lot of people with angina, but it tends to settle. So a lot of this elephant on the chest feeling seems to be something like that, but it goes. She said a lot of people are becoming PoTSy, as she called it, and I'm sure you use that phrase. And for a lot of people who already had PoTS or dysautonomia, that was perhaps being made worse. But again, the tendency she felt was to improve, but we're talking over months rather than weeks. It's really common, we've found, that people are really quite distressed, because one of the big problems has been not actually being able to get into the health services and sometimes not being believed. So that's common. And I think people need acknowledgement of the problems they have. The other thing that seems to impact on people at work is relapses. Some people, just like you said about your husband, relapsing, remitting, you know, it comes and it goes. And we don't know what that's caused by, but for my money, that's one of the things that causes real difficulty getting back to work. And I think getting back to work needs to be slow and gradual. And we are recommending and working with the Society of Occupational Medicine that return to work needs to be really gradual, like over months, not weeks. We would, you know, your average phased return might be 4 weeks, but we're actually saying more like months, with lots of little adjustments. So those pulling out the things that cause people problems. But it's not just chest pain, people get nerve pain, headaches, and so on. I've got one more slide. I might as well just say it while there's another picture.
Yeah, I'm just trying to find it. There we go.
Okay, another one by this lovely lady, Paulina. We keep getting told to think positive, and have we tried this and that? And I just thought she did this wonderful cartoon. This is what we're going through. You know, every bit of our body's hurting or tired or whatever. We're very limited, so it looks like medieval torture, but we're anxious. We tried yoga, and the ravens are picking over the pieces there. So again, I think it's quite useful. So thanks, Amy.
Yeah, no, I think the only other thing I'd add in about the return to work, I think for a lot of us, as we know this is affecting women a lot more than it is men, is also remembering the burden of your daily life at home. That when you're doing a return to work, you've got to remember all the other stuff that you've got on your plate, whether you're a single parent or you're caring for an elderly relative, or whether you've got, you know, all the household cleaning to do and all the other bits and pieces. I think that's what it was advised to me before I went back to work that I had to be functioning normally for 2 weeks at home prior to going back to work. And for me, that was a big step, because once I did go back to work, of course, I was exhausted again. And then I wasn't able to do all the things at home that I could have done before. So I guess it's just when we're speaking with our employers, just to make sure we're not just taking into consideration what we're doing at work. It's just the whole picture is really, really important.
Absolutely.
I just threw up the signed guidelines just for links for people if they haven't seen them. So on the left is the one that's for doctors, and on the right is the one that's for patients. And just to mention that a lot of work is being done on these. I can't remember what they call it. They call it a live guideline or something like that.
Something like that.
Where they're updating them all the time. Not all sign and nice guidelines are like that. Quite often they're kind of done as a one-off and they're reviewed a few years down the line. But this is very much being constantly looked at, and hopefully will be improved over time. So GPs have now got something to go to, or all doctors do, but there are certainly things in there that can be worked on, and Claire and I and the various groups we are in are trying to lobby hard to get them even better and make sure that they represent all of us. So, but those can be quite helpful just to look at, especially if you're struggling with your GP who may not understand about it. This was just something actually that I came across on Twitter. So I'm quite an active Twitterer, whatever you call them. I had been asking for help about how to kind of manage pacing. I never knew what pacing was before. And I think that's something that's important for all of us with chronic illnesses. And this was highlighted to me by a patient with ME. Now, I don't have ME. A lot of us don't have ME, but I think the advice in this book is invaluable. There's an incredible section which talks about keeping a symptom and activity diary and making sure that you learn what triggers your relapses, what triggers your fatigue, and that can be applicable to any illness, really. So if it's within your means, this book's excellent, and it's actually even written in a way that if you've got fatigue, that you can read it easily. It's summarized constantly, it's written in bullet points, it's ring bound so that you can hold it open in a way that's not fatiguing on your arms, which for me in the early days actually was really important. So highly recommend this book. And then this is just a little something I wrote about various things that I think probably a lot of us have tried at different times. But in terms of managing fatigue, the one I put at the top, although it's terribly boring, is probably the one that's helped me the most in terms of managing my fatigue, and that's cutting out sugar. I never realised, I don't know about you, Claire, but I never realised how much what we eat and drink, and it might sound daft, really impacts on our health. And you know, I know with PoTS, there's lots and lots of fluid, but actually cutting out alcohol, caffeine, all these things is really important.
Well, they were just triggering loads of things, sort of mast cell type reactions and all sorts of other things, weren't they? And so people have experimented quite a bit. And I mean, it is, actually, I've never met such a compliant group of patients as the doctors in the long COVID group. Because I found it, I can't do the compression stockings. I hold my hands up. But, you know, really 100% people have been doing.
I haven't tried yet either, I confess.
Okay.
But I mean, these are all different things that people have tried to help make themselves feel better, and certainly we know with PoTS and dysautonomia that recumbent exercise is something that's supposed to be quite helpful. So a lot of those things can be done in a recumbent fashion that might be helpful.
I think that's what we've sorry, carry on.
No, go ahead.
I was just going to say, I think that's what we've learned from collaborating with groups. I've been sort of working with Mount Sinai in New York, their rehab clinic, and they're the world leaders in rehab, and they said they've never seen such a debilitating virus, and they had to take their exercise program right back to basic breathing. They have 4 weeks of breathing training and exercises before they get into anything They can't even put people on a full protocol of anything else that's standardized because it needs to be so gradual at first, this sort of recumbent exercise and so on.
And I think that's something else I've learned recently, actually, is how helpful pulmonary rehab can be for patients with PoTS, which I wasn't aware of before. And I think even in areas like Scotland, where we haven't got long COVID clinics, that almost everyone can access pulmonary rehab. So if you do have PoTS and you're struggling with breathlessness, ask your GP for referral for pulmonary rehab, because actually you may benefit from that, and that you can access pretty much anywhere in the UK, I think. So it doesn't have to be through a long COVID clinic. These are just some links I've put together of things that you may find helpful. The first 5 are videos that Sheffield University have done, which I thought were really, really helpful. And other links in there that you can have a look at. Sorry, it's probably not the best colouring to look at for stuff, but maybe you can pause the YouTube video when it comes to have a look at them, and maybe some of them maybe post on the website if they're helpful, I don't know.
Would you be willing for us to share the slides after the session?
Yeah, absolutely. Yeah,
okay, so we can do that, or if we can't share the slides, we'll make sure we share all the links. Okay.
Yeah, that's fine.
So yes, that's me if you want to find me on Twitter and hear me rant.
We've not ranted, Amy.
So yeah, there we go.
There we go. Yeah, I mean, we just wanted to allow plenty of time for questions as well. So
yeah,
hopefully we can pick up some there.
Okay, well, thank you both so much. I think thanks for being so honest. I know it must be really reassuring for people in a similar situation to just hear people in the same boat and what they're going through, because I think, you know, PoTS can be very lonely and you feel very isolated. And I'm sure, you know, long COVID is very similar as well. And it must be lovely. And it sounds like you've had some great support from your Facebook groups and things like that. To be able to share experiences. So thank you both very much indeed. I don't know if you can see the questions, but we've got loads coming in, so we will try and get through as many as we can. So if we start off, we've had one that was emailed in and also one that's been asked live about exercise. So the question that's been asked live was, what would you recommend regarding exercise? So maximum heart rate, duration, frequency. And the emailed question was, do you know if anyone has successfully been treated with an exercise program like the Levine protocol for post-COVID, for dysautonomia and postural hypertension? So just kind of any advice on exercise and different protocols?
Shall I tell you what I've been discussing with Mount Sinai then? They I mean, for nearly a year now, I've been chatting to them, and they tried to start with something like the Levine protocol, but found that even that was too much for people with long COVID. So they were reluctant to give any particular, name to any particular program. I think it's all about and what they were discussing recently with me is not pushing people to certain trigger points. So it's very individualized. So if you do something that you know is going to make you feel really bad the next day, or even straight away, then don't go to that point. And so, as I've said, I think they've started with a really basic sort of respiratory retraining, and then it's just really gradual build up according to what they can do. I mean, I know from being a patient with autonomic problems that my specialists have said to me, we can rehab the same as other people, but it takes longer. And you need to have a physio, probably an OT as well, but if we're talking about exercise, a physio who has some specialist knowledge of PoTS and low blood pressure, because it just has to be done more gradually. More attention to detail, and certainly lying down or staying flat, first of all. I mean, I think some forms of yoga people find too much for them, whereas something like Pilates is especially if it's done by a physio, is probably safer. I do Pilates, and so I think it's individualized and slow. Sorry for the long answer.
There is a Facebook group, Susie Bolt Yoga. So she's done a yoga. There's several videos available online, free, and then you can also sign up to her classes. And she's done a lot for patients with long COVID. And I think, and also in one of the links I put Jenny Jack article on pacing, she talks about heart rate and linking it to heart rate in there, and that's quite helpful just as a baseline to see where you're at. And I think, as Claire says, you've got to listen to your body. And they say that whatever you do in terms of pacing, whatever you manage, if you're feeling good for a few days at that level, then do that plus 10%.
Yeah.
It's not like most of us who are like, oh, I'm feeling good for a few days, I'm just going to go and do everything because I feel good, and then you crash afterwards. And I've done it so many times. But actually, and I think, you know, we were asked a question about what's available, and I think a lot of it is, as Claire says, it's about physios knowing about it, but even physios who are willing to learn about it. You know, actually, if you're paying privately, you know, try and find someone, and if not, are they willing to go and read about it? A lot of the NHS physios who work with ME and chronic fatigue syndrome services will be aware, so you can sometimes go down that route to ask for advice. So that's probably other ways I would look to get help.
And the long COVID physio group, any of you can access, has got some because they're physios who might have long COVID, but who are certainly looking at exercise programs. So look on their links on their website as well.
Yeah.
Okay, that's great. Lots of good resources. So I'll make sure that I email everybody the slides afterwards so that they can have a look through all of those. Loads of information, and I guess it's finding what's right for your individual circumstances. So that's great. Do you believe that this will force more research on the condition and possibly tie up answers on similar conditions such as ME, MCAS, fibromyalgia?
I really hope. I think inevitably, yes. I mean, my personal view is that, like long COVID, these conditions aren't just one thing, and that clearly there is something wrong when people have these symptoms. And I think it will, and already perhaps has started to raise awareness of some of these other things. I think it's long overdue.
Yeah, I work with a charity called Chest Heart Stroke Scotland, who have a helpline for patients with long COVID. And we keep saying, like, if we can get this right for long COVID, we can get this right for many chronic diseases. And I'm really hoping that we can extrapolate out, you know, we're developing these networks, we're liaising with third sector, primary care, secondary care, trying to get it all together. And actually, if we can get this right, there's no reason why we then can't adapt that model for all illnesses. And, you know, there's a lot of research money, especially in the US, $1.5 billion they're putting into this. You know, I really hope that, you know, the ME, chronic fatigue syndrome patients, all of the fibro, all of these groups can benefit from that, because actually there are similarities and links. They're not all the same, but I think we can definitely learn from each other. So I'm absolutely not fighting just for long COVID, and I know Claire isn't. I know the rest of us are really hoping that we can get this right for many, all the millions missing, as we know they're called, you know.
Okay, brilliant. Thank you very much. Another one we had emailed in is it normal to have more fainting and dizzy spells after contracting COVID?
Oh, for sure. For sure. It's really, really common. And I think as symptoms, those absolutely have to be investigated. Mm-hmm. You know, we have put together simple guidance about how you know, looking at as well to the guidance that you have on PoTS UK, that the test can be done in a simple way. So you are looking for things like PoTS, but there are other causes of fast heart rate. There's all sorts of things about COVID that can make you feel dizzy. So it needs investigation.
Okay, brilliant. Thank you. What percentage of people, you actually, I very much doubt you're going to have percentages because it's just so hard, but it's saying what percentage of people who get COVID end up with long COVID, and what percentage of those are likely to have PoTS? I'm sure you're not going to be able to reel off stats here, but do you have any sort of anything to say on those?
Well, what's it called? ONS, what does that stand for again? Office for National Statistics.
Yes.
Has recently put out some figures which suggest that 1 in 10 people who have COVID that we know of develop long COVID or continue to have prolonged symptoms. Let's put it that way. I don't know what percentage. I haven't seen any percentages that might have PoTS, but I would say it's fearsomely common.
Yeah. And I think the one message I'm getting out to my colleagues in teaching and things that I'm doing is to please examine your patients. Because I think that's the problem that a lot of us have had over the last year is face-to-face access with our GPs. So a lot of us have been able to speak to them, but I've been trying to say to my colleagues, please, if your patient's got a fast heart rate and palpitations and chest pain, and it's worse at night, that even if they are 25 and female, it's not going to necessarily be anxiety and they need to be examined. And I'm very much pushing that message out there. And so I think, you know, don't accept medication over the phone. Please, you know, ask to be examined, because I think there are things being missed because of this.
Yeah, there are.
Okay, brilliant, thank you. Somebody's put that their sister is currently in hospital with severe PoTS symptoms following COVID in December. She's totally debilitated and unable to even sit without fainting or vomiting. Yeah. Has anyone experienced such severe symptoms, and how do we help while she is hospitalised under a non-specialist team? Have you got any advice?
I would ensure, I've heard of it happening. It needs obviously proper fluid management and salt balance. I would say that's, you know, she may have to have IV fluids and so on. I think it's getting not under a specialist team. They've got to get on the things that may help, like the antihistamines, you know, for associated conditions, and medication. You know, you do all the first line things that the PoTS UK says, and you know, if she's that bad, you may need to try. But I think if you're not getting anywhere, then it's to ask for a specialist, or at least for them to phone a specialist in a different hospital who is listed perhaps on your website as being one of the ones that knows about it.
Yeah. Okay. I mean, I think this is the common problem, isn't it? It's actually getting to a specialist that, you know, is an expert in the field. So we have got a long list on our website, like you say, but it's nowhere near as long as we'd like it to be, and we are trying to add to it all the time, and we are having a bit of a push at the moment to try and get people to let us know if they see somebody who is a specialist that isn't on there. So for anybody listening that is the case, please do get in touch with us. There's a question here. My girlfriend and I have had long COVID for over a year. Do you think that there's an explanation for couples both getting it, i.e. high viral load in the household? So obviously, Amy, you said about you and your husband. Is there any connection there?
I don't think anyone's come up with any answers to that one yet. I mean, I did question that in terms of high viral load. Was that a thing? Although other families have had similar things and didn't have, you know, who knows? And I think also it's interesting to see how it's different. So my now 4-year-old certainly has had no post-COVID sequelae, but my nearly 7-year-old every now and then gets mini relapses. I certainly haven't spoken to a doctor about it, because it's not something that I'm particularly worried about, because I can manage it. He just gets fatigued and he gets recurrent conjunctivitis in one eye, which he had at the time of being ill, and that's the only way in which it presents in him. But I'm aware of a family in Aberdeenshire who all 4 of them have horrendous COVID. The kids can't go to school, the mum can't work, you know, so there definitely are household features, but who knows as to what that is, whether it's a strain, the viral load, or what.
Okay, I mean, it kind of links into the next, it's more of a statement really than a question, but somebody's put that their brain fog didn't kick in till about 5 months, and 11 months on, this is one of the worst symptoms. So it's not a case of you get long COVID, this is your problem, and that it will remain that way. Is that how you've both experienced it?
Well, yes, absolutely. Sorry, Amy, go on.
Well, I only lost my sense of smell 5 months in.
Wow.
So it was fine until that point. So absolutely. I don't know about you, Claire.
Yeah, well, I think there's a key thing here which hasn't been noted by many researchers and things, that there is a shift somewhere between month 3 and 4, somewhere thereabouts. And there's clearly a sort of perhaps an immune mechanism that's kicking in, something which so it's really, really common to develop new things around about that time. For me, it was the chest pain, difficulty breathing, and the cognitive problems. But they did get better. After about 6 or 7 months of that, my horrible word thing and a lot of the other sort of brain symptoms did improve. So I think it's very typical. I would love to know what's happening when things shift to some new symptom, because I don't think it's still virus at that point. Probably not, but yeah, definitely. The thing to do, I think, the things that you can do anything about with managing your brain are, using your brain is going to make you feel tired. So take that as activity and rest from it when you've done something with your brain. make sure you're not overtired, so enough sleep if you can. Managing the PoTS type situation if you have it, because obviously you need the blood getting to your brain. So it's all those measures really.
Yeah. Okay, that's great, thank you. There's quite a few questions about people who've got PoTS or very new to it, or have had it for a long time but just never been given any advice on how to manage it. I think I definitely refer you to our website and have a look through. There's loads and loads, and like you said earlier, it's simple advice to follow, but it's really trial and error as to what works for you. But is there anything in addition to what you said, any sort of PoTS related that you feel are the really key things that you would recommend people should do?
I think the really key things for me, and this goes back a number of years because I've had the autonomic problems a number of years, it's adequate salt and adequate fluid. Absolutely number one. Recognizing when other factors are there. So if it is hot, if you've exercised, your veins are gonna, your circulation is going to open up, so all the fluids in your boots. So feet up if it's really hot or you've been walking for ages.
Yeah.
But salt and water, enough of that.
Brilliant. Okay. Are there any signs that having the vaccination can reverse long COVID?
I think it's really interesting. There's lots of anecdotal stuff going on at the moment. Gez Medinger, who's been doing loads of videos on long COVID, I put his name at the bottom of that last slide. He's done a whole episode dedicated to this, and he was running various surveys trying to see who has felt better. Personally, it made no difference, but then I was already at a much better baseline, I think, in terms of my PoTS being managed. So I didn't expect to see much difference, but I have heard people feel a lot better, and I've unfortunately heard some feel worse. So it's really difficult to say, and I don't know that we'll know for a long time to come. That will come out in the wash, I think, with all the stats. Although I don't know what even stats they're collecting on it. That's the problem, because even when you go for your vaccination, there's no box to tick to say that you've got long COVID, which I think is a shame, because I think there was a trick missed there in terms of data collection.
Yeah.
And I remember saying it to the nurse at the time, you're not asking about it. No, what is long COVID? So, but that was back at I was the second day of vaccinations. But yeah, I think there is a shame there that it's not really, I don't know that we'll ever know, because I don't know that the data's being collected to show it.
Okay. There's a couple of people in the chat box who've had a positive result of having had their vaccine. So fingers crossed for many that will be the case. Somebody's put that they're a nurse in a respiratory ward and worked throughout the pandemic. She had her second COVID vaccine and developed long COVID symptoms within a number of days. She's never had a conclusive diagnosis of COVID, but has developed PoTS, fatigue and breathlessness. Have you got any tips for her regarding returning to her work? And as a nurse, she's doing 13-hour shifts, so it's a tricky one.
Oh, it's really tricky. It needs to be gradual, depending how long she's been off.
I said she then. I'm sorry, it might be he.
Sorry. Yeah, sorry, that's terrible. Sorry. If it's been a prolonged period of absence, then will need to be a prolonged period of going back in. We would always say, vary your duties, don't be on your feet all day long. I think this is where the NHS and other employers could use a lot more imagination than they are using, because there's always loads of things that people could do, and it needs that flexibility of thinking, yeah.
I would add,
carry on. Yeah.
Don't go back to work without an OC Health review. And I think that's a problem. A lot of people are doing that, and I think because the waits for OC Health, especially in the NHS, are quite long. But I don't go back until you've had a proper OC Health assessment and a proper risk assessment done.
Yes.
And push for that. And don't settle for
Absolutely.
A bit of advice.
And the leaflet that you've done at PoTS UK about long COVID and work, or PoTS and work, is brilliant. Leslie asked me to have a look at it, and it's really superb. It's got a whole lot of really useful ideas for any job. I would take that in, take it to the health appointment to the managers, and the Society of Occupational Medicine has also done some leaflets both for managers and for workers. They're easily available on their website, but if I can always let you know the address. But yeah, definitely an OH appointment.
Brilliant. Okay, well, I think we'd said we'd finish at about 1:45, so we will leave it there now. I think there's lots of questions that we haven't got round to answering. I'm not saying that Dr. Rayner and Dr. Small will be able to do this, but if people who haven't had their question answered or it hasn't been covered, if you want to email trustees@potsuk.org, it won't be something we're able to respond to instantly, but as a team at POTS UK, we will do our best to try and get back to people or kind of collate maybe a news item on the website with some of the queries that we didn't get round to. So as I said, I can't promise that will be instant, but if you email them in, we will do our best to try and cover them, because we always like to try and get through as much as possible. But I think it'll leave me to say thank you both so much. I think the work that you're doing is just incredible. And, you know, as we said before we kind of started this session, you're both extremely busy. You've both got loads of other commitments. And I think that people are undoubtedly really grateful that you're giving up your time to do this. It will be on the YouTube channel, definitely within 48 hours. And if people can do the survey just to provide a quick bit of feedback, that would be fantastic. But thank you all very much indeed.
Well, thank you so much for asking us.
Absolutely,
really lovely.
Is there anything you wanted to say before we finish? Anything that you've kind of not said that you want to cover?
I think you'll get through it. I think it's going to take time, you know, if you have it, and patience.
Get out there in the support group. You know, there's nothing like being around other people who know what you're going through, because it does feel really lonely. And I think the support groups are so helpful. You will get through it, and you will eventually get better, but as Claire says, it takes time.
Brilliant. Well, I think that's a really lovely note to end on. Thank you again both for giving up your time, and thanks to everybody who attended the session. We hope you found it useful. Thank you then.
Thanks.
Bye.
Bye.